The final product we are trying to kill, but the factory is still on. The breeding is always there. And at one time, this mosquito, Aedes mosquito lays eggs not less than 3,000. So we are killing a few, and 3,000 are getting produced. There is no end to it. So I request all, let's give an extra thought to this disease, because this is a killing disease. When I was at Chikalim, there were 2 deaths, and there was an outbreak. My own colleagues started calling me Dr. Dengue. Dengue is because there was a lot of dengue there. So if it spreads fulminantly. Before it spreads, if we can do something, that is what we should be aiming at. So I must congratulate Dr. Kalpana for a wonderful job. She has brought down the number of dengue cases and dengue deaths to the number that can be measured on the fingertips. That's a Herculean job that she has done. The wonderful team that we have, the wonderful team of health officers, and especially our sanitary inspectors who are doing a wonderful job. So we are doing a good job in Goa. And thank you, Dr. Kalpana, for inviting me for this wonderful function. See a lot of crowd here. And I hope each one will teach one, and this message will go far, far away. Thank you. Thank you so much. If at all it comes, that should be the breakthrough. Or else, what is left to us is what is rightly written here: check, clean and cover. Who will check? Who will clean? And who will cover? If this question we can't answer, then it is only half solved. Who should clear? Who should clean? Who should cover? Dr. Kalpana, is it? We should do it. I mean, public at large should do it. And therefore, the slogan is people-led prevention. People expect that everything should be done by health department. And I had an experience in Kurtorim when we went for fish drive. We introduced fish in that well, taking the permission of that well owner. And the immediate next question was, "Ata pai kalnu uspita to me?" Right? Meaning people want everything to be done by us. We can only help people to help themselves. This is the loud message. We help people to help themselves. If they are ignorant, we teach them. But more than that, we can't do anything big. So this is the day when we ourselves teach ourselves first, so that when we talk to people, we are confident enough. We tell them the facts, we tell them the truths, and we tell them their responsibility. I believe the whole story of this day today is to give this message. It is said, Jal hi Jeevan hai. You all know about this? Of course. Jal hi Jeevan hai. But if you ask me, 70% of the illnesses, infectious diseases, they are transmitted through water. These MVB diseases are also transmitted through water. So where comes the question of Jal hi Jeevan hai? Idhar to maran hai. Jal hi Jeevan hai, provided you manage water properly. And therefore, this check, clean, cover, and that blue barrel syndrome, which we experienced in Vasco when we went to Sada area, and we told them to cover or empty that one, every weekly dry day. They said it is impossible for us to empty everything. The reason is that they said if one of us gets dengue, we have Chikalim hospital, that time it was cottage hospital, we can go there and the patient can be treated. But if we empty everything and next 4 days the water doesn't come, then we all are dead. Blue barrel syndrome. People store water because we have irregular supply of water. And therefore, this coordination meeting that everybody has, a share. The education department, the transport department, the water department, and all other departments and panchayat and municipalities, we all should work together. And this is the day when we take a pledge that together we can achieve it. All alone, health department, we simply cannot achieve it. Mind you, this is a viral, a good social worker. We have Dr. Kalpana, who is leading this program from front, and of course Dr. Baptist, who is my colleague. We together are leading this drive to control the diseases. And I see many of the sanitary inspectors with whom I have worked. I see many of my colleagues, my health workers. And as I understand, there are people from different fields, rightly so. Because as people think to control a disease or the health issue is the sole prerogative of health department, it is not exactly so. The very reason that people from different fields have come here underscores that we can't control a disease, especially a disease like dengue, by health department alone. Dr. Kalpana actually has very widely elaborated what the dengue is, what are the different types of dengue strains, what are the vaccines, what is the treatment, what we should do. So actually, so to say, she has eased my job, but then it has made it difficult also. Then I'm thinking, what do I talk next? We have also heard about, we talk about malaria. My question to you all is, which of these two diseases, malaria, so frequently occurring, and dengue, which is the most dangerous one? Can anyone? Dengue. And I would want you all to, give a thought as to why dengue is dangerous than malaria. Is because malaria has a concrete treatment. Dengue is a viral disease and it doesn't have any special specific treatment. What we can do is only support the patient, and if the patient is lucky and the doctor is lucky, then the patient will be survived. Dengue is very, very unpredictable. Today evening the patient is good, tomorrow morning the patient is no more. Very, very unpredictable. And as doctor has said, it is a day biter. At night we are at home in a safe environment and we can protect ourselves. But when we are out, when it is a day, we never know when the mosquito has bitten us. So it is a day biter, it is a multiple biter. One mosquito can bite several times. And more importantly, it has trans-ovarian transmission, doctor has already said. That means even if a few eggs are left on a utensil and now the water is not there and the mosquito cannot breed, later on, up to 2 years, maybe she may correct me, when that eggs will get water, they can hatch again and can develop into a mosquito again. So that dangerous is dengue. And therefore, such programs like National Dengue Day is celebrated just to create more and more awareness, just to integrate, just to coordinate with all the stakeholders so that together as a team, we can control dengue. This is an opportunity for all of us to take a stock of the situation, which he has already done, as to what were the cases a few years back, what are the cases last year, what are the cases now, and what should we be doing in future.
Using still stronger chemicals for fogging. If you start using it indefinitely, then we may develop resistance. The mosquito can develop resistance to this chemical. Also, it can have a bad effect on the children and elderly in the community. So we have to restrict. We have to go as per the guidelines. Then personal protection. Everybody is supposed to use the personal protection. I will not tell you what all, because there's so much available on the. Lot of advertisement is done for that. Then fish introduction drives. We abuse the fish in unused well, fountains. We have 34 health centers. Out of the 34 health centers, 31 health centers are having hatcheries where this guppy fish breeding is done, and it is distributed free of cost to the community, where they can collect it from the health center and they can introduce them in their fountains. Or now there is a hobby of growing lotuses on the balcony, aquatic plants in the balcony. They can introduce these in those aquatic plant or lotus plant pots. Now regarding the dengue serotyping, are traced back in the field and their surroundings and their houses are checked for breeding so that we do not get dengue cases in future in that area. IEC, there's a lot of IEC is being undertaken by health services, distribution of pamphlets, leaflets, community in the community, school awareness drives, etc. Anti-larval measures as and when needed, anti-adult in and around positive patient's house to knock down the adult infected mosquito. At this juncture, I would like to tell that we get a lot of requests for fogging because of mosquito nuisance. But what I would like to tell that as per guidelines, it is used to knock down infected mosquito when there is a case. But when we tell this to the community, they feel that we are waiting for the case to come. So in that case, what we have planned, what I have suggested to the in charges, don't refuse fogging. But before conducting the fogging, see that that person's house as well as surrounding houses are checked for breeding. Is in the water, clean stagnant water. Mosquito breeds in domestic and peri-domestic areas in and around our houses. Even 5 ml of water, 1 teaspoon is enough for breeding. Hence, it is the duty of every individual to keep their house and surrounding free from potential breeding sites and receptacles. 2 types of Aedes mosquitoes are prevalent in our state. Aedes aegypti breeds in domestic man-made water receptacles found in and around our household, like water storage container, overhead tanks, refrigerator plates, disposable cups, grinding stone, industrial and domestic junk, construction site. Hence, community participation very important. And the second type of Aedes which is prevalent in Goa is Aedes albopictus. It breeds in natural larvae habitats including tree holes, latex collecting cups in the rubber plantation, leaf axils, bamboo stumps, coconut shells in Kuragar. This year we have to work towards reduction of cases and death. For this, community help is very important so that they report early and they report before the warning signs to the health centers. These are the health center-wise dengue cases. Last year, like every year, we had more cases in the north than south due to more construction site, more migrant settlement areas, housing societies, rented populations and kuragars in the north. This year, all the health centers are informed well in advance about a trend, hotspots, rise in Aedes vector indices for initiating proactive, preventive and control measures. All the sub-centers are instructed to plot, map their hotspot, conduct source reduction drives with the help of line bodies. So now what is dengue? Dengue is a viral disease. It is transmitted by the infective bite of female Aedes aegypti mosquito, which is a day biter, which immediately leads to cluster formations. Persons suspected of having dengue fever or dengue hemorrhagic fever must see a doctor at the earliest. At all our health centers, I would like to tell all present here that at all our health centers, whenever a fever case comes to the hospital or the health center, the test for malaria as well as dengue is conducted and the treatment is given. But also I would like to tell all the community or general public that people should not take lightly or neglect the warning signs like abdominal pain, vomiting, unable to retain anything in the body, high fever, low pressure, cold clammy skin or bleeding from any of the sides like gums, nose, stools, etc. as dengue is fatal. Period of communicative. Infected person with dengue becomes infective to mosquitoes 6 to 12 hours before the onset of the disease and remains so up to 3 to 5 days. There was a slight increase and after analyzing it, it was noted that out of the total 567 cases in 2024, 235 occurred during the pre-monsoon and post-monsoon due to unsafe water storing practices and 332 are the cases which occurred during the transmission season. Out of the 3 deaths which occurred, 2 of the deaths, one in child and one adolescent, occurred because of late reporting with severe warning signs to the hospital, and the third one was because of the elderly patient with lot of comorbidities. Hence, we have to be very careful regarding this. Hence, early reporting at the onset of fever to the nearest health center is very important for prompt treatment and to prevent fatality. There was an increase in cases from 2,33,251 cases in the year 2022 to 2,89,235 cases in the year 2023. And also there was an increase in the death from 303 deaths in 2022 to 485 deaths in 2023. But in 2024, there was a dip in the cases, and also the death cases also came down from 485 cases in 2023 to 235 cases in 2024. In recent years, dengue cases are showing an increasing trend. However, the dengue case fatality rate, death per 1,000 cases, have remained less than 1% at a national level. From this slide, you can note that all our neighboring states have high incidence of dengue, and our influx are also coming from these high endemic areas. Hence, we need to be vigilant, which lead to dengue and which has been a positive factor for increase in the dengue cases in the recent years. Construction activities, which is rampant in Goa. Unsafe water storage practices, very common in migrant settlement areas and rented population. Population movements, work-related travel to other neighboring endemic states, and also travel to urban areas for job purpose, although staying in some remote villages in Goa. Thereby, there is importation of virus to these remote villages. Then heavy rainfalls, vector abundance, rapid urbanization, suboptimal solid waste management. The state of Goa has all these risk factors. Dengue, and all those people present here who have taken their time and specially come to grace this occasion, all my dear friends, good morning to you all. Dengue, an arbovirus disease, is an outbreak-prone disease which continues to be a major public health concern across the country. In recent years, its geographical spread and frequency of outbreaks have increased significantly, particularly during the monsoons and the post-monsoons. This rise is largely attributed to factors such as higher temperature and heavier rainfalls, which create ideal breeding grounds for Aedes mosquito, the vector not only for dengue, spread of dengue, but also for spread of chikungunya and Zika virus. Every year on May 16th, since 2016, with the recommendation of Ministry of Health and Family Welfare, Government of India, to create awareness about dengue and to intensify preventive measures and preparedness for the control of disease in the country before the transmission season starts. This year is the 10th National Dengue Day observation. The theme for this year is Clean, Check, Clean, Cover, Steps to Defeat Dengue. Just विकास साफ करे, ढके, डेंगू का हराने का उपाय करे. This theme is very apt, as health alone will not be in a position to control and prevent dengue. Inter-sectoral coordination is very important with other departments, especially community too. The theme for this year is very simple, which each one of us can practice and make a big difference in prevention and control of dengue. This day is observed annually to help create public awareness regarding this mosquito-borne disease. The observation focuses on vector control, active community participation continuing throughout the transmission season. Multi-sectoral approaches promoting healthy environments have proven effective in dengue control. Therefore, active engagement of local authorities and community is crucial in minimizing Aedes breeding and reducing the risk of transmission.
Subscribe Prudent social media channel and press bell icon for latest notifications.